Hello, I'm your host, Dr. Braha. Welcome to the Zermed Show. On the show, we will feature local physicians and healthcare leaders who are experts in their respective fields and who will share their experience and wisdom with us. We cover a broad range of health topics on the show, and today we have Dr. Michelle Soto, Chief of Ambulatory Care at New York City Health and Hospitals South Brooklyn Healthcare. Welcome.
Thank you for having me.
Yeah, Dr. Soto, it's really nice to have you on the show. You're in charge of a very, very important part of healthcare at a very important institution here in South Brooklyn. And I think it's a great show for our patients because ambulatory care really means, sort of the first place people end up when they start to see doctors in the offices. And for our viewers today, we're going to talk about primary care and specialty care here at South Brooklyn Health. First, everyone wants to know who you are, where you're from, a little bit about you. How did you end up here? Tell us your life story.
I will try to be brief. Thank you once again for having me. I am a Brooklynite. I'm born in Brooklyn, and I am from Puerto Rican descent. So I'm happy to be here and say I'm bilingual. So I meet a lot of the needs of the community that we're serving. I am a board-certified internist and also an addiction medicine specialist. I attended medical school at Sophie Davis and then SUNY Downstate. I've been in the health and hospital system for many years at different institutions, and I'm really happy to now be at South Brooklyn Health.
So you're from Brooklyn, educated in Brooklyn here with Sophie Davis, which is a very prestigious medical school and program, and here at South Brooklyn Health. Tell us a little bit about what ambulatory care means for our viewers today who are watching.
So ambulatory care really means where you go to get your services, not just when you're sick, but also how to prevent illness. I believe in primary care, in prevention, and this is where you come to do that. We want to make sure that our patients know how they're doing. We want to know that you come for your yearly checkups. We want you to come in to just if you're not feeling well, come on in. And then we'll be able to determine you need to see a specialist beyond just seeing your primary care provider. So we are that gatekeeper.
Yeah, the primary care provider to our viewers today is really your first stop for almost everything. For children, it's the pediatrician.
Yes.
For adults, we call it internal medicine or family medicine.
Mm-hmm.
And so your training in internal medicine and in ambulatory care is really the first stop that someone should make in their healthcare journey. Tell us, why is it so important for a healthy 35 or 40-year-old watching today to come and see an internal medicine, a primary care physician?
So we want to make sure that you are healthy because you believe you are, but we want to make sure that you really are. A lot of people don't realize that there are things happening in their body that may lead to problems down the line. So we want to check your blood pressure. Hypertension is a silent killer, so many people don't know that their blood pressure is high unless they get it checked. We want to make sure we're screening patients for diabetes. Even if there's no family history for diabetes, you may be at risk. If you're overweight or if you, depending on your diet, you may be at risk for diabetes. So we welcome everyone to come in, get their checkups. We want to make sure that we're checking for annual screenings that are age-related for cancer. So whether it's referring you to get to women's health, if you're a woman between the ages of 21 and 65, getting your cervical cancer screening. Once you're 45 and over, sending you to the GI specialist for colorectal cancer screening, and so on.
Yeah, when we think of primary care in medicine, it's really mostly prevention, or that's what we want it to be. We don't really want to treat a disease. We'd like to prevent a disease. And for our viewers that might be young and feisty and there's nothing getting in their way, we want to keep you that way. And so prevention is important for our viewers, that we don't want to wait till the check engine light is on in the car. We want to get the preventative maintenance done before, so we don't end up in an emergency room. And so we talked about these cancer screenings. They begin at an early age for women, and for all of us, in terms of colon cancer, that starts at 45. Let's focus on women's health. What services here at South Brooklyn Health do you offer in the ambulatory setting for our female viewers today?
So we offer prenatal care, we offer routine GYN services, and we do offer specialized care. So any woman who's having issues with bladder control, which may happen as a woman's getting older, any issues regarding surgeries related to the uterus, the ovaries, we can offer those services here.
How soon should a female who's watching today, young and healthy, how soon should they start seeing the primary care doctor or the gynecologist for their early screenings?
Very often they start with their pediatrician. Those conversations usually happen there. That's the first place. And then we refer them to usually a women's health provider starting at the age of 21 for their first pap smear.
And this is if they're healthy, completely fine, they really need to see a women's health provider at a young age. And for men, we start thinking of other problems a little bit later in life, like our prostate and our colons. Men's health services here at South Brooklyn Health. Let's go over a little bit of what you have to offer, and what should the men who are watching who say, I don't need to see a doctor right now, what should they be thinking about, or what do we need them to hear from us?
So we definitely want to look at the entire health. We want to look at mental health, because we sometimes forget about mental health for our men. Want to do the screenings for hypertension, diabetes, but then we have specialized services like urology. Any man who's of an age who's starting to have symptoms related to the prostate, erectile dysfunction, we can refer to a specialist to make sure they're getting adequate treatment.
Here at the ambulatory center and the ambulatory care that you provide, tell us a bit about other specialties, because this is an umbrella term of ambulatory care for many, many services, which I'm sure that you offer here. Let's go over some of these services and maybe explain the different specialties to our viewers who might be suffering from symptoms in these specialties and know that they need to come out here and see somebody.
So I will stay with primary care first for some time, because we do offer geriatric services. So for our patients who are 65 and over, we do offer specialized geriatric care. We have board certified geriatricians who can offer care to the older adult as their body is changing. They're having changes with memory. They can help focus those services. We offer beyond primary care. We're offering, if we look at the medical specialties, we offer cardiology services. And our cardiology service has expanded to also offer invasive procedures, cardiac cath. Anyone who's having chest pain can get an assessment, and we can take a look. Is there a blockage in the heart that we need to intervene? We offer services through our GI team, gastroenterology. That's where we complete our colonoscopies. People who are having discomfort in their abdomen, acid reflux, so we treat a whole array of these symptoms. We offer services for nephrology, so our renal specialists. We neurology, which are the specialists for our brain and our nerves. We make sure that we refer patients appropriately if there's any symptoms of pre-stroke or after having a stroke. We want to make sure that patients are getting the care that they need. We are offering from there specialized infectious services. So we do have HIV services and other routine infections, pulmonary services, tuberculosis treatment is one of the treatments we do offer here in the hospital. Beyond that, we have surgical specialties that we also offer at South Brooklyn Health.
So really the whole gamut of medicine is pretty much available here for our viewers. When they're thinking about setting up a primary care appointment, what's the first place that someone should go to seek out a primary care provider, a physician to help take care of their health needs? What's the first step that they should take, especially here at South Brooklyn Health?
So we do have a number that they can call through our contact center. It's 1-844-NYC-4NYC or 1-844-692-4692. But we do have our doors open. So many of our patients come through the emergency room when they're ill, and then they get referred to us in the ambulatory care setting. They may get hospitalized for an acute problem and then get discharged and get referred to us. Some patients walk in, they're not feeling well, they're looking for services, or they don't know how to start, and they come into our practice Monday through Friday, 8 to 4. So we do offer walk-in services when someone is not feeling well.
And when they come and meet with the provider and they set up their file, they get their tests done, there's new technology out there today. and people are able to access their records, they're able to see their results, they're able to look up diseases online. What kind of technology advancements here at South Brooklyn Health can the patients look forward to when they are under your care?
So we do have an electronic medical record, EPIC, which is an amazing record because we can see their visits across our system at NYC Health and Hospital. So if the patient goes to another hospital, we can see those records. If they give us permission and they've gone to another institution, we may be able to see those records as well and share information as long as we get the patient's permission. The patient can have access to MyChart. So MyChart is the patient portal for access. They can take a look at their medical record, seeing their vaccination history, their labs, seeing the notes from their provider. They can request a medication refill, request an appointment, so they have a multitude of services through MyChart.
Yeah, this app is pretty incredible. I don't know if you've used it.
I have.
I've used it myself with my own doctors. And it's really a great technological advancement in care for our patients to be able to see their records and to see their results, and really makes for maybe a more educated consumer, a better participant in their healthcare when they can see their test results, and they can contact their provider through these portals. It also makes it really nice because of sharing of information. Our patients don't have to run from one hospital to another to get records often, and we have it all in one place. We talk a bit about technology advancement here. There's a new building here. There's a new hospital, the Ruth Bader Ginsburg Hospital. Tell us how that's impacting your primary care, your ambulatory care, and what we can see in the future.
So it's opening doors to a whole new inpatient service, which means our patients are going to get great access, great technology that's coming with the new hospital. Robotic surgeries is coming. It's already here, but we'll be expanding, so we're looking forward to that. But it's also making up space for primary care. Our emergency room will be moving from this building into the new building. That means the primary care space will get a brand new home. We're getting a 26,000 square foot space that will be renovated. It will be state of the art. It will be a beautiful space for our patients. We were fortunate enough to get a $17 million grant from our elected officials so we can do this space. So our patients will be getting technology in a beautiful new home.
So we've talked about what is offered here. We talked about the different specialists you have, the technology in place, the facility that's improving and expanding, and all that you have. Let's focus on a couple of diseases for a bit for our viewers who may be thinking, I could have this, I could have that, maybe I should check, maybe I shouldn't. Let's talk about a couple of markers for the adult patient and a couple of points that they need to look out for. Like, what's normal blood pressure, cholesterol? What are some of the points that you look for in every patient that's watching here today? What should they be aware of in some of these early markers that you and I would check in the clinic, like cholesterol, blood pressure, other markers of health that we should look at, diabetes, A1Cs. Let's pretend I'm the patient here today. What would you be checking on your first visit?
So we always start with checking your weight. We want to know, do you fall under a normal weight, or have you gone beyond what's considered normal for your height? It's important to know that because that can be a precursor for many diseases.
That's the BMI.
The BMI.
Right. So for viewers today, the BMI, they can go and Google what is my BMI. So you're calculating it on their first visit.
Yes.
And it's a combination of weight and height. So for our viewers, they can Google this and figure it out while they're watching right now.
Yes. So based on the body mass, they will get the height, the weight, and they will get that interesting formula to get what their BMI is. What number are we looking for here? Less than 25.
Less than 25. So if you're Googling it right now while you're watching us and it's over 25, we got to talk.
We have to talk, and we do have a wonderful weight management service that we can refer them to. So we want to check their blood pressure. What is their blood pressure? For an adult, we're looking at less than 140 for systolic and less than 90 for diastolic. If it's an elderly patient, we want to see how healthy they are, and the numbers may vary slightly. A diabetic patient, I'm going to try to be a little stricter, so I will aim for 130 over 80 or less. That would be my goal. We want to maintain health as long as possible. For our patients who have who come in, we will always screen them for diabetes as an initial visit. There's a lot of patients who have an elevated blood glucose and may not know that they have
It's silent.
diabetes
Yeah.
or pre-diabetes.
Very possible to be walking around with a high blood sugar and not realize it yet.
Yes.
Yeah.
Some of the symptoms may be increased thirst, feeling like their vision is changing, a little blurriness. They may find themselves a little dizzy and may not understand where these symptoms are coming from, increased urination, more hunger than usual, and not realize that all these symptoms can be related to diabetes.
So if you're watching and you're hearing some of these symptoms, which can occur very commonly, they may be the early signs of diabetes. And so you can check for this through a simple blood test.
Yes, so through a blood test, so we do the random sugar, but we can always do the hemoglobin A1C. It's a 3-month test and it gives us an idea what has your sugar been like. Our goal is to have everyone below 5.6. Between 5.6 and 6.5, it's a gray area of pre-diabetes. I think this is a great opportunity to say, let's start making changes. This is an opportunity for diet change, increasing physical activity, and reassessing what you're doing. Just because you have slight elevation in your hemoglobin A1C doesn't mean you have to develop diabetes, because there is an opportunity for change.
This may be an early warning that we need to
Yes.
start tightening up our belts and not eating as much, exercising more. What else can we screen for on our first evaluation? We talked about diabetes, blood pressure. What else are
Very
you looking
often
for?
we'll check urine. We want to see, is there any blood in the urine, any signs of other abnormalities like bacteria in the urine, because they can be infections, they can be kidney stones, and they will just let us know, are the kidneys healthy? Through the blood work, we will be checking on the liver function, we will be checking on the kidney function. And as part of routine visit, I always offer HIV screening at every initial visit. Why? There's a lot of patients who may not know their HIV status. So it's important to simply screen as part of a routine.
Can someone, many people would come in when I was doing primary care, they just want to be screened for STDs. They're concerned that they may have had an exposure. Is this something that can be done by just coming in and visiting one of the primary care specialists?
Yes, so we can offer urine, whether the person is symptomatic or not, we can offer urine screening for chlamydia, gonorrhea. We can offer blood screening for syphilis, hepatitis C. We want to make sure we screen everyone for hepatitis C at least once. There may be someone with hep C that they don't know that they have it. We will also screen for hepatitis B.
So these are tests that don't take long to come back. A quick visit, they get the results pretty rapidly, I would say within a day or two. And how do you communicate with your patients? Is it through the electronic portal? Do you call them? Are they able to come back pretty quick for a visit, or are they waiting long months for another visit? How easy is it to get back into the practice?
So we will schedule a visit after that initial visit to make sure that we don't miss anything, that the patient comes back and we do our follow-up. But the patient will be able to see the results through my chart. If there's an abnormality, we will either send a message through my chart or call the patient and ask the patient, come on in beforehand, or there was an abnormality, your cholesterol is a bit high, let's talk about diet change, let's make a referral to a dietitian. So we can initiate a lot of change before you even come back to the next visit.
With the EPIC program,
Yes.
the electronic chart, they can get their results quickly, so there's less anxiety waiting like we
Yes.
used to. We used to go to the doctor on one day, come back a few weeks later to go over results, and we would panic for weeks, hoping that it was okay. There's another area of primary care that's important to talk about, and I'm sure that you offer it here, but what about updating vaccination status? Somebody is concerned about travel, they're concerned if they're immune to Hep B. We all are aware of the COVID pandemic and updating their vaccines. How do they go about these services here through ambulatory care?
So we offer a large array of vaccines here, and it depends on the risk factors for the patient. We will offer Hep B vaccines routinely. If the patient hasn't had their measles, mumps, rubella, we will offer varicella, polio. Unfortunately, we've seen an increase in cases, so we want to make sure that we're screening appropriately and we're offering the vaccination, especially anyone who may not have a history of vaccination in the past.
Here at South Brooklyn Health, the facility here is growing, it's beautiful. Are there any other sites that we offer? If someone is living a little bit further away, is there transportation? How do we get here? People are watching today, I don't know where they are in Brooklyn. What advice can you give them on getting in here or about searching for primary care related to South Brooklyn Health?
So we do have a community health center that's affiliated with us. the Ida G Center on 19th Street. It's one of our sites. We do offer primary care services, dental services, and chemical dependency services at that location. They're open Monday through Friday, 8 to 4, and chemical dependency has extended hours. So those are some of the services. We are near some public transportation sites. There's multiple trains, buses, so we are available.
Easy to get here.
We're easily accessible.
Let's talk a bit in our last few minutes about chemical dependency. I know that's one of your specialties,
Yes.
and one of the specialties that is offered here at South Brooklyn Health. For the viewers today, if it's them or a relative they're concerned about, what services are offered here? How do they know that these are the services they need? Is this an appropriate place for them, or do they need to go somewhere else? Maybe you can shed some light on chemical dependency care here.
So the first place to go to is your primary care provider. If you're concerned that my drinking may be a problem, I'm using substances that I want to stop, but I'm having challenges stopping. It's creating a problem in my home life. It's creating a problem at work. Then that's a sign that you may want to seek help. We encourage everyone to come on in. We will offer services in a non-judgmental way, and I think that's the biggest concern. Will anyone know? Will anyone think of me any differently? So we want to make sure that patients know, come on in, share your concerns. We will make sure that we link you to the services that you need. We do offer multiple services. We do offer Suboxone treatment in primary care, so that if the patient's not interested in getting care in a setting that is for chemical dependency specifically, they're able to get Suboxone through their primary care provider. So that is an option. Anyone who's interested in quitting smoking, we forget that smoking cessation can be done in the primary care setting. And many people are interested in quitting, but they've tried, haven't been successful, and don't think that they can be. So we do offer smoking cessation within primary care. Anyone with alcohol use disorder, we can offer services as an outpatient. They no longer have to stop working. They no longer have to go into a rehab to get services.
So comprehensive substance use disorders can be treated here at South Brooklyn Health, which is really fabulous, because it seems like sometimes it's hard for people to get in the door, but this is a judgment-free zone.
Judgment-free
Available
zone
to everybody. And let's talk a little bit for our viewers today, now that they know about everything available here, which is incredibly comprehensive, and it seems the services are in good hands with you. Insurance. They're worried about whether or not they can come here. When they call, will they check their insurance card? What if someone doesn't have coverage? In our last minute or so here, give us some information about how they can get in the door from an insurance standpoint, financial standpoint. Do they have to worry?
If you're concerned, give us a call. We can let you know what insurances we accept. But most importantly, if you do not have insurance, do not be afraid. We do offer services to our patients who are uninsured, irrespective of their immigration status, and that's the most important. We want to make sure that everyone knows they can come in and get services.
Yeah, it's very important for our community members who may be uninsured, underinsured. Immigration status is not an issue. And the population who is missing insurance or hasn't really participated yet doesn't need to wait to end up in an emergency room. That they can get the primary care services here if they need them.
Yes, so we can help prevent emergency room visits by coming to your primary care provider.
No one wants to wait in the emergency room for many, many hours when we could have prevented that. And so for our viewers, it really is important to understand that South Brooklyn Health is really opening their doors to you, and whatever you can do to provide primary care. It's really great to know that you're here and providing this. Thank you for joining us today. Any last messages or tips for our patients or viewers today, potential patients for you, that you might have?
I would say, come on in. We are here. We want to make sure we take care of you and your entire family, from your children to your parents. We want to open our doors to you.
Yeah, so it's really nice, and that's a great message that the doors are open. Continue in your good health care here, and your good provision of care, and this great ambulatory center that you're running. Thank you for joining us, and for our viewers, they'll be able to call the number you provided. It'll be on our screen. They could probably go to the website for South Brooklyn Health and find the number to call up. Maybe they'll even see you, who knows, or one of your great providers when they come to the clinic.
Thank you for giving us the opportunity.
Hey, it's a pleasure, from a real Brooklynite who is giving back to her community and taking care of all of our health. Thank you so much for joining us.
Thank you.
Thank you for your interest in the show and your desire to become involved and educated. I invite you to visit our website at www.zurmed.com. Check out our tools, connect with us on social media. You can also call us at 718-510-2103. Please stay well, be safe, get your primary care, visit them at South Brooklyn Health. I'm Dr. Braha. Stay safe, Brooklyn.